Edgar with your bioplastic surgery. Today's patient story, radiation chest wound. So a lot of people are familiar with the therapeutic and diagnostic applications of radiation throughout medicine. In fact, there are entire specialties and divisions of medicine devoted toward these applications, like nuclear medicine, radiation oncology. But a lot more people are less familiar with the potentially deleterious impact of radiation on the skin and soft tissues. And that these effects can occur years and even decades after the treatment is given. This 71-year-old presented to one of my partners with this persistent drainage, large left chest wound, pain in the left chest, and inability to wear her left breast prosthesis. Now, 16 years before she presented to one of my partners, she was diagnosed with left breast cancer and had a left mastectomy and opted for no reconstruction. And she had left chest wall radiation. She also had a lift procedure on the right breast. Now, if you look carefully at this wound up close, you can see that there's a broad area of dyspigmentation and skin change in the distribution of the radiation treatment. And you can see that the skin has this very thick and woody, non-pliable, rigid kind of appearance and quality to it. Now, there's also a central area of necrosis there, which this patient reports as both painful and persistently draining. And there's also a lot of calcifications there. And this is completely adherent to the underlying ribs and chest wall. So my partner took her to the operating room and biopsied that site to ensure that there wasn't any cancer or of any form there. And the patient was sent to me for reconstruction. So I took her to the operating room and widely excised the entire chest wall lesion. And you can see the size of the wound there. This is the patient laying on the table. You can see that the pec major is evident in the deep aspect of the wound. The ribs are there. And what you'll notice is I've widely excised the lesion, but I've left a few areas of skin change where the underlying subcutaneous tissue looked pretty healthy, but there was radiation skin changes. And I want you to pay attention to that because we're going to see how that changes as we bring in vascularized tissue to the area. So to cover the wound, I used really one of our workhorses in plastic surgery, the latissimus flap from the back. And I take that with the large skin paddle as shown here, and that's brought around to the anterior side as shown here. Now note also that those areas, as I mentioned, of residual skin radiation change that were left behind. So here she is at 2 weeks post-operatively. You can see the large scar from the back. That's the donor site where I take the flap from. And here she is when I see her at 3 months. And she's ecstatic at this visit. She gives me a big hug. And she's thrilled. She says she's pain-free. There's no more wound. There's no more drainage. And she's back to wearing her left breast prosthesis. So I'm very happy for her there. Also as shown in this picture is you can appreciate those areas in the previous images where there were some radiation skin changes. Those have been markedly improved by bringing in this healthy vascularized flap to close the wound. Now, obviously, this isn't a breast. Our goal wasn't a breast reconstruction. This was chest wall coverage and closure so that she could wear her prosthesis again. And finally, here's her result at 2 years with, again, continued benefit in the skin, stable soft tissue coverage without recurrence. So I hope you enjoyed this patient story of the radiation chest wound. I hope it illustrates something I see fairly commonly in my practice is long-term deleterious effects from radiation. As always, make sure your surgeon's board certified. Ask for preoperative and postoperative pictures. We'll see you for the next patient story.